Knock knock. Hi, my name's Jenna. I'm your nursing student. Can you please verify your name and birthday? Look at your wristband. Do you have any allergies? Look at the wristband. Provide privacy. Do hand hygiene. I'll check the provider order. Today we're going to connect you to suction and then put a sterile dressing on. And I will wear gloves when necessary. First, I'm going to make sure everything is gathered here within the expiration date. I'm going to put on my gloves, get my tape ready. And then I'm going to grab this connection and keep it sterile, and then connect here. I will make sure it's clamped while I'm doing this, and then I will unclamp once it's done. And then this is unclamped, and I will connect it to suction. And then turn it on. Once that's done, I'll take my gloves off and I will wash my hands. And then I will start my sterile field. Touching only the 1-inch border. And then I will open, drop, open, drop, and then I will open the petroleum gauze and just leave it to the side. I will make sure not to touch the sterile part. And then I will get this tape ready. Now I will put on my gloves. And I'll go under this one, making sure not to touch the inside of the cuff. Then I'll get that off the table. Okay. So now I can grab my petroleum gauze, just touching the inside, so sterile to sterile. And back up and get it in like a hot dog position. I would make sure this gown is already up. And then turn these close. And then I'm going to, this hand's not sterile anymore, making sure not to touch the skin. I'll layer that. And then, use my gauze. And then I'll drop that. And then put that on. Okay, once that's on, I'll apply tape. And then I will label that with my date, time, and initials. I can take these gloves off now. And then I will, once I label, I will check the tubing for any clots or kinks in the tubing, making sure it's connected to the right things. I will check for subcutaneous emphysema, so crackling in the tissue, or crackling when I feel it, and that's air in the tissues. And then in this, I will check the suction for intermittent or continuous bubbling. The water chamber, I will check for titling, and that's it will move up and down when the patient breathes in and out. And then I will check drainage for color amount and making sure that it's draining correctly. We will check vitals every 15 minutes for the first 2 hours, and then per policy protocol. And I'll make sure my patient's in a comfortable position and safe.